how do we optimize either the amount of blood to be transfused? What is the difference between standard versus as needed transfusion? And what are some of the symptoms that we can watch out for as a trigger for transfusion?
Right. Thank you. So as in simple terms, one could think of thalassemia being an anemia, which means a lack of blood. But this is not the type of anemia that you can treat by giving a medicine. Or there are no really effective medicines. Some medicines are being developed, but they don't bring your hemoglobin back to normal. So the treatment is the transfusion. And the more closer the hemoglobin of the patient can be brought to a normal hemoglobin level, the better they feel. And the further lower the hemoglobin falls from the normal, the worse the patient feels. And if you look at the long-term health, if you maintain hemoglobins close to normal, then people with thalassemia will do really well in the long term. They will stay healthy, they will be productive, they will contribute, and they will have family and everything else. But if you don't give enough blood, or if there's a problem in procuring blood or safety of blood, then the patients are going to feel weak all the time. Children don't grow up very well. They have deformities, and they really can't contribute in any way to the society. So how to manage transfusions has been a really important component of thalassemia care. There are many standards that have been developed. Hemoglobin level thresholds have been proposed. But the question in many cases is, how do you monitor? And specifically, I think when patients have to travel long distances to come for blood transfusion, as is often the case in some centers in India, it's common to see 4, 6, 8 hours of travel for families to get to a center where they can get blood. Knowing what the hemoglobin level is ahead of time would certainly help. And that could even perhaps send a trigger to the blood center that this patient needs blood in the next 2 or 3 days, and they can get ready to receive the patient that way. But I think improving communication in the setting where transfusion centers are only in a few places, where the patients are very widely spread out, and transportation is not easy. There are economic hardships on the families. So all these things can be made better with the use of technology, I think, and better communication between patients and the transfusion centers.
That's excellent, and some very practical aspects of the treatment management. Thanks a lot for elaborating on that.